This is Radio Health Journal. I'm Nancy Benson. This week, the fight after COVID against PTSD.
When someone gets a ventilator put on them, it can be very traumatizing because you're not just dealing with the discomfort, but also confronting the reality that you very well may die.
The lasting mental health effects of COVID when Radio Health Journal continues.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
There were 25 of their planes that went up that day. 13 got shot down. 12 came back. And the survivors that came back told horrifying stories of how many hundreds of German fighters swarming around them.
The on- and off-screen life of the late actor Jimmy Stewart. Then,
most of my diet is vegetables, tofu to some degree, but I do eat some fish, and one of the reasons I eat fish is because fish is actually a pretty good carbon deal.
Crafting a diet for a better climate. I'm Marty Peterson.
and I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station, and subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
Over the past year, at least 30 million people across the country have recovered from COVID-19. But for some of those patients, recovery has come at a very high cost. Beating the virus may have meant being rushed to the hospital, put on oxygen, intubated, or placed on a ventilator, isolated from loved ones and forced to fight for life. And aside from the physical effects many survivors are now living with, the mental trauma associated with recovery from COVID is staggering. Researchers are pointing to a link between COVID and post-traumatic stress disorder.
PTSD is defined as a reaction to an adverse effect where one fears for their life, right? There's some sort of an attack on them that they can't control. So when someone gets a ventilator put on them, right, or the BiPAP machine, or they're in the hospital, the ICU, it's terrifying because you know this is happening because you're having trouble breathing on your own. It can be very traumatizing because you're not just dealing with the discomfort of having to wear this machine or have this machine on for hours at end, but also confronting the reality that you're struggling to breathe and you very well may die from this.
That's Dr. Sanam Hafiz, a clinical psychologist at Columbia University in New York. She says studying PTSD among COVID patients has been especially challenging because the pandemic is ongoing.
Generally, PTSD exists in about 8 to 9% of the population. In certain populations, high-risk populations, like first responders, which was my research study, in 2002, I think it's difficult to really talk about studies right now because we're all chasing our own tails, and it's so hard to get a study down while you're trying to save lives and get people back on their feet and, be able to go out and collect data and whatnot.
An Italian study of 381 COVID patients found that nearly a third of those who were very ill developed PTSD after treatment. First responders and family members who've watched the desperate struggle of others may also be affected, but we don't know much about that yet. Hafiz says it needs study because it may be significant.
So with PTSD, with COVID, it's hard to say if the PTSD, how much of that is just coming directly out of, COVID, how many of these people, the 30% that the study found, were already afflicted with anxiety and depression. So far, it is not unimaginable or unreasonable that people recovering from COVID have PTSD. I think there are probably people who didn't have COVID, but watched someone very close to them have COVID and developed what we call secondary trauma.
So how might symptoms of PTSD manifest in a former COVID patient?
So let's say if you were someone who had COVID and recovered from COVID, and your breathing is somewhat back to normal, it can become sort of a phobia because you're constantly monitoring your breathing. If we might be having trouble breathing, people might be afraid to fall asleep. Very much like people who have sleep apnea or something, like, oh my God, what if I stop breathing in the middle of the night? This is all a reaction from COVID. You might have visual flashbacks of you in the ICU or struggling to breathe or going to the hospital and have a difficult time shaking it off.
Hafiz says a year into this pandemic, a year into wearing masks, practicing social distancing, and hearing case numbers climb, we've become adaptable to our new reality, but also more numb to the horrors that have come with it. For patients with PTSD, their trauma can be easily reignited in their day-to-day lives.
So if you have PTSD, and this is something we know in research and clinical literature, and if you've had PTSD from one event in the past, you may have recovered from it, but it makes you more susceptible and vulnerable to having PTSD again from another traumatic event. One of the things about anxiety or PTSD or any kind of phobia is the longer you stay with something, the more commonplace or more easy it becomes to adapt to. There is a normalcy because everyone is uniformly experiencing it. It's also gone on now for about a year, which makes it less novel and less new and strange and unfamiliar. We have more knowledge around it. Deaths are declining. Vaccines are here. But that being said, someone who's experienced COVID and the worst of its side effects or watch someone close to them go on a ventilator can still feel the trauma because they are basically facing death or the probability of dying from this disease.
A survey conducted last year by the National Council for Behavioral Health found that more than half of behavioral health organizations have seen an increase in demand for services over the past year. That survey also found that many of those groups had to close programs because of pandemic-related challenges. Hafiz says she's seen this play out in her own office.
Now, the demand is so much higher, we just don't have enough people to respond to it. And I know that firsthand because I've got patients who, even for my practice, which has never been true, I've got a waiting list for the first time in God knows how many years. People are calling constantly saying, I can't get an appointment. I know there are hotlines. People don't always know how to access those hotlines. And people are really struggling.
Hafiz says there are some things that PTSD patients can do from home to help manage their symptoms. She suggests sticking to a routine and practicing meditation. But it's important to know when to get help.
Having a set time to go to bed, a set time to wake up in the morning, structuring your day where you're like, I am going to go for a walk, or if it's raining or snowing outside, I'm going to do 2 or 3 15-minute sessions of exercise. With PTSD, because a lot of the problems are the intrusive images and the thoughts, maybe avoiding caffeine before bedtime so you don't have nightmares. There are certain foods that can activate a part of the brain where you can have more active nightmares or dreams that are bothersome or troubling. Going to bed early enough, putting away the phone. Oftentimes PTSD is marked by like a hypervigilance and replaying the events and nightmares and recurring intrusive thoughts about the event. And those folks really do need mental health help. They need to see a psychiatrist or a psychologist.
You can learn more information about Dr. Hafiz and all of our guests on our website, radiohealthjournal.org. Our writer this week is Libby Foster. Our studio producer is Jason Dickey. I'm Nancy Benson. Coming up next week on Radio Health Journal.
We had a patient who had divided her house down the middle because she couldn't stand the smell of her partner, and it was destroying their relationship at the time.
How COVID may destroy the sense of smell.
Then research at an exclusive prep school 50 years ago that would be called sexual abuse today.
Schools that were engaged in this, that were doing this, certainly should have known better. This was unethical research.
All that and more on Radio Health Journal.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.